Hi, welcome to my channel. This is a continuation of ARVs resistance video. Yeah, so there are three major mechanisms of HIV. I mean, of ARVs resistance. So number one, we have what we call mutation in viral enzymes. If you remember them, rest in peace. This is reverse, this is integrase, this is protease. So changes in reverse transcriptase, protease or integrase enzymes reduce the effectiveness of ARVs targeting these enzymes. And then the second one, we have what we call reduced drug binding. Yep. So structural changes in viral proteins can prevent ARVs from binding effectively, reducing the ability to inhibit viral replication. And then in third, we have increased drug efflux. So meaning some mutations can increase the ability of HIV to expel drugs from the infected cells, reducing intracellular drug concentration. Let's quickly look at the diagnosis. How do you diagnose resistance? So there's what you call genotypic resistance testing. And then there's also what you call phenotypic resistance testing. So under genotypic, identifies specific mutation in the HIV genome associated with resistance to certain drug. And then phenotypic measure the ability of the virus to grow in the presence of ARVs, indicating the level of resistance. So how do we manage and prevention of resistance? So we're talking about management. Actually, let's start with prevention and management. So the first one is to improve adherence. So you can say adherence support. So ensuring the patients take their medication consistently and correctly through education, counseling, and the use of adherence tools, peer organizers, reminders. And there's this tool which is called it should be, I've forgotten the actual term, whereby you can organize, whereby a patient comes to take the medication from the facility, they drink from there. This is what we call combination therapy. Using a combination of ARVs, usually 3 or more drugs from different classes, to reduce the likelihood of resistance. There's what we call resistance testing. So performing resistance testing before starting or changing therapy to guide the selection of effective ARVs combination. Switching regimen. So switching regimen. Yeah, so changing to a different ARV regimen if resistance develops based on resistance testing result. And then 5, monitoring viral load, regularly monitoring viral load to detect. So you can say viral load and CD4 count monitoring. Yes. So regularly monitoring viral load to take virological failure and make necessary adjustment to the treatment regimen. So prevention of resistance prevention of resistance. Basically, so early and effective treatment. Early and effective treatment. We also have patient education, addressing barriers to adherence, regular follow-up, all those kind of. So, lastly, I'm going to quickly talk about a very interesting aspect of this. So, I want to talk about nucleoside reverse transcriptase inhibitors mutation. Nucleoside reverse transcriptase inhibitors are a class of antiviral drugs used to treat HIV, and they are very potent. However, mutation in the HIV reverse transcriptase gene can lead to resistance against nucleoside reverse transcriptase inhibitors. Yes, so key nucleoside reverse transcriptase mutation, nucleoside reverse transcriptase mutation. So we have M184 VI. So drugs affected. We have 3TC, that's lamivudine, and the FTC. So what is the effect of this? High level resistance to 3TC and the FTC. So high levels, but this act as a significant act as a so it acts as a significance in management of HIV because mutation to lamivudine or Cytaba increases susceptibility to zidovudine, AZT, and tenofovir. So it increases susceptibility to AZT, lamivudine, tenofovir, TDF. So meaning these two drugs will work better. In layman language, meaning the viral will become more sensitive to this drug. So this drug will work better, yes, because of the mutation which occur to 3TC or FTC. No wonder 3TC, FTC, TDF, and AZT. These are the backbone of HIV management. Yeah, so mechanism decreases incorporation of 3TC and FTC into the viral DNA, reducing the effectiveness. And then we also have what we call K65. Drug affected, we have tenofovir, we have abacavir, ABC, we have didanosine, which is a very DDI. We have also 3TC, there's also FTC. So effect causes moderate to high level resistance to the affected drugs. Mechanism reduces the incorporation of these drugs into the viral into the viral DNA. And also, we have what you call K70E, drug affected medical student. Make sure you master this. Pharma student, nursing student, doctors. So TDF, K70, so TDF, Abacava, Danosine, 3TC, and FTC. If it causes moderate resistance to this drug, mechanism similar to K65R, it interferes with the incorporation of the drug into the DNA. And then we have what we call thymidine analog mutation, the TANs. So we have what we call thymidine analog mutations, the TANs. Yep. So key mutations of thymidine analog mutation. We have M41L D67N K70 L210W T215Y K219QE. Drug affected AZT, zidovudine, D40 stavudine, causes high level of resistance to AZT and stavudine, and can also decrease the effectiveness of other nucleoside reverse transcriptase inhibitors. So these are very bad mutation. Mechanism enhances the exertion of incorporated nucleoside reverse transcriptase inhibitors from the viral DNA, reducing their effectiveness. So let's talk of Q151M. So drug affected the multiple nucleoside reverse transcriptase inhibitors, including zidovudine, didanosine, stavudine, Abacava, and 3TC. So if it causes more drug resistance to several NRT, very bad, can cause more drug resistance. Yes, decreases the incorporation of several nucleoside transcriptase inhibitors into the virus. So, what are the consequences or effects of this mutation? So, number one, treatment failure. And the resistant mutation can lead to a loss of efficacy of the affected drugs, resulting in the treatment failure and increased viral load. And then we have what we call cross resistance. Some mutation confer resistance to multiple NRTs, complicating treatment options and the recurring careful selection of alternative drugs. Compensatory mutation, in addition to compensatory mutation. In addition to primary resistance mutation, compensatory mutation may occur to restore the viral fitness lost due to resistant mutation. Yes, so we already talked about the management or prevention. So genetic resistant testing, combination therapy, adherence support, switching regimen. Yeah, thank you so much. And kindly tell medical student, pharmacy student, nursing, even doctors, even student intern doctors, pharmacists, those who want to learn, those who are writing NAPLEX, NCLEX, FPGE, MPGE, other exams, PSZ exam in Zambia, LEX exams, to follow my YouTube tutorials, Abraham, and then Facebook, tutorials Abraham, and also tutoring and servicing, tutoring and consultant services, sorry, both on Instagram and Facebook. Thanks so much, and God bless you.